Hey everyone, welcome back to 5 Minutes Learning. Today, let's stretch our usual video and really talk, just us, about Deloitte's mental health first aid program. Sound good? Imagine your workplace for a second. It's like a vibrant beach, teams splashing, building sandcastles, everyone working together. But what happens when the waves get rough? If someone gets caught in an invisible riptide, who's the lifeguard? That's right. It's HR and leaders who are trained to spot trouble and help. Ever thought about that? Let's be honest. Workplace stress is skyrocketing. You feel it, right? We all do. By 2025, about 63% of workers are showing signs of burnout. That's huge. Maybe you've seen it in your own team. Deloitte found that poor mental health costs UK employers around £51 billion a year. Let that sink in. It's not just numbers, it's people. For MBA candidates and future leaders, this is what will define your leadership, more than any model or theory. Are you ready for that responsibility? Gen Z and millennials? They're reporting higher anxiety than ever. 40% of Gen Z say they feel constant anxiety in recent surveys. That's a lot of your friends and colleagues. And here's something we don't always see, the hidden cost called presenteeism. It can actually dwarf absenteeism in lost productivity. Surprised? This isn't just a soft HR issue. Depression and anxiety cost the global economy about $1 trillion a year. $1 trillion! That's why this matters. Deloitte's model shows that for every pound invested in well-being, you can get back around £4.70. That's a return any business would love, right? Proactive support flips the script. More engagement, better retention, higher innovation. It's a win for everyone. Wouldn't you want that for your team? Okay, let's get practical. How did Deloitte help managers become mental health first responders? Imagine we're climbing the lifeguard tower together, ready to see what's up. Deloitte started by setting a mental health baseline in 2021. By 2023, it was rolled out to everyone. Why do you think that matters? That baseline meant no stigma, real leadership training, and hands-on toolkits for everyone. Think about how that could change your workplace. By 2025, Deloitte grew this into a full MHFA program, e-learning, workshops, and digital tools. Imagine having those resources at your fingertips. Their award-winning e-learning reached thousands of managers, maybe even someone like you. Pretty cool, right? Then, they certified leaders as first responders, real practical training you can use. Would you step up if you had the chance? They use a simple framework called ALG. First A, assess risk of harm or suicide. Why start here? Because safety comes first. L, listen without judging. Sometimes just listening can make all the difference. G, give reassurance and information. Let people know they're not alone. E, encourage professional help when it's needed. It's okay to ask for support. E, encourage self-help and other supports. What support would you want if you needed help? ALG gives leaders a clear practical playbook, no medical degree required. Anyone can use it. Here's a real story. A manager in Deloitte, London noticed a high performer pulling back during hybrid work. Sound familiar? She checked in. I've noticed you haven't been yourself lately. Are you okay? Simple, but powerful. He accepted confidential support, came back stronger, and the team's productivity improved. That's the impact you can have. Now the question, does MHFA move the needle? Deloitte measures closely. Their evidence points to returns, over £4 for each pound invested. In teams with many trained leaders, engagement rose, turnover fell, absenteeism dropped. Personal stories confirm it. Employees saying a manager's MHFA training saved their career here. Qualitative shifts, more open conversations, reduced stigma, more people accessing support. Campaigns like Are You OK? Became lived reality, normalizing check-ins. But scaling to 400,000 employees isn't easy. Culture, language, and stigma vary. Deloitte invested in localization, working with local clinicians and HR teams. And privacy matters. Managers are trained to listen, not diagnose, and to protect confidentiality. Cost and scale solved via train-the-trainer models. Embed expertise internally. This lowered long-term costs while keeping quality control. Continuous measurement lets Deloitte refine content, add privacy safeguards and regional tweaks. 3 practical lessons for you. First, start with a baseline assessment. Second, train managers. Make MHFA core to leadership development. Third, connect managers to EAPs, counselors, and clear referral steps. Ask simple questions. Listen fully. Connect to help. Make resources visible. Post links in team chats and meeting notes, and measure outcomes, engagement, well-being, and psychological safety. Deloitte's MHFA shows HR as a lifeguard, spotting distress, intervening early, and saving careers. Ready to be a lifeguard for your team? Don't forget to like, subscribe, and hit the bell for more case studies on 5 Minutes Learning. Share this video with your study group, and let's keep learning together. I'll see you in the next one. Stay curious.